Oh, okay, let me start on this project now. This project is exploring the correlation between overcrowding and community health. Basically, I will be analyzing and trying to find if there's a correlation between population density and community health in U.S. counties. So, in particular, I want to look at community health, how it's measured using county data on several variables, which include the percent of residents with fair or poor health, the average number of mentally unhealthy days, the average number of physically unhealthy days, percent of adults with diabetes, a lot of variables to actually be measuring uh, physical and mental health. What I want to do is have a balance between health indicators, physical and mental, because both are very important to overall community well-being. And the data used in my analysis comes from John Davis's data set on Kaggle. He's a biomechanics PhD student at, if I remember correctly, Indiana University. And he gathered weather, health, socioeconomic data in this one data set from the year 2020 to see which communities and counties were most COVID vulnerable. So there's actually data from 3,142 counties. So, well, as an introduction, I already spoke about the variables that I'm interested in. The response variable is going to be the percent of residents with fair or poor health, which I'll explain in a bit. The average number of mentally unhealthy days. I don't know, this presentation will be a little bit long, so I don't know if I'll get to the rest of the response variables. And the data source I said again was from John Davis. So before I move on to some of these variables and how I'll be working with them, I just wanted to show the code of how you read the data set into Jupyter Notebook. Read it in as a CSV file. You can see here, titled the data. I selected the columns I'm interested in. County, percent overcrowding, population density per square mile. Actually, these are good measures of population density, right? Because if we go to the first slide, I'm looking at how overcrowding and community health are correlated. So we have good measures of overcrowding here, these variables, and then I select these columns into a new data set called my variables. And the first thing I wanted to do was check if there were any missing values under the primary care. Um, just a second, actually. Okay, I'm back. Sorry about that. I believe I got an important phone call. Actually, I don't believe I know I got an important phone call. So let's get back to the project. So where was I? I was just checking if these variables, if they had any missing values. I want to clean up the data, get rid of the missing values. That's why I use the .is null um, function. Um, and I continue to do that .is null on every single variable of interest to figure out if I have missing values that I need to clean up because that's going to mess up the part where I correlate different values, the part where I create a histogram of their distribution that could, potentially be a hindrance. And also, I created a summary table using the display function. And at the top, we're just seeing these variables of interest and some of their important statistical describers, count, mean, standard deviation. I think one thing we can say, for example, percent overcrowding, we have 340, 3,144 pieces of data there. So two more than the amount of counties. So we have maybe some extra. The mean, this is telling us, well, we haven't spoken about the percent overcrowding variable yet, but the mean is 2.14. Standard deviation. Standard deviation is not large in comparison to the mean. If we go to population density per square mile, the next variable column, we can see the mean is 277, but the standard deviation is 1800. So it's a big range, big variance. It's telling us that actually the mean is not uh, a good indicator of the middle ground for this variable and that there's quite a bit of skew in our data. Anyways, just a basic rundown of some of these descriptors. And when we go down, we see actually the counties being listed. And next to the counties, we can see their precise measures for each of the variables. So if we take Kansas City, we see their percent overcrowding, their population density, 525, etc. So yeah, this slide is just saying again, what the summary stats tell us. I gave an example of an interpretation for the mean from all 3,142 U.S. counties. The average population density per square mile in 2020 was 277 people per square mile. Okay, we can go back here and look at that value, population density. The average population density for all the counties in 2020, 277 people per square mile. Then again, there's a huge standard deviation. So that measure tends to vary a lot. That's what we're being told there. And yeah, I gave that in the example here about the standard deviation. The county with the lowest amount of people per square mile had 0.04 people per square mile. We're told that in the minimum, as you can see right here. Then we have the interquartile ranges, the percentiles, etc. So let's talk about my first explanatory variable, which is the percent overcrowding. This one is a very interesting variable, actually. So it's very different to population density. It's actually more personal and more specific. So it measures the percentage of people within any given county that live in an overcrowded household. So an overcrowded household here, as measured in the original data set, is defined as one in which there are three or more people per room. So it's not including kitchen or bathroom. So as opposed to population density, this reflects the living conditions within individual homes. That's why I mean it's a more personal measure of overcrowding. And it's good. It's very specific. So I picked this variable based off the assumption that overcrowding is more prevalent in densely populated areas. And although the two measures of population density and overcrowding are not synonymous, populations often outstrip the supply of land and sufficiently spacing spacious housing in denser areas. Yeah. Too much population, not enough land, not enough availability of sufficiently spacious housing in denser areas, like I said. So as a result, overcrowding rates would seem to tie closely to my research question, focus on population density and overcrowding. So in terms of outcomes, overcrowding has been shown to correlate to factors of community health, such as higher rates of spread of disease and infection. And it also seems worthwhile exploring the correlation between crowded living conditions and symptoms of distressed mental health, as it's possible that there is a relationship among these variables. But in general, this variable establishes population density at the household level and clearly defines what counts as overpopulated. So the clear definition is three or more people per room. So this precision, for the purpose of my analysis, is very good. It makes it much easier to find relationships between population density and community health outcomes. Uh, just a second. Okay. I've returned. So yeah, as I was saying about the percent overcrowding variable, um, well, I guess the next step would be now to look at the histogram. So I create a histogram for this variable. We have on the x-axis the percent overcrowding, and it's a density histogram. So we're told the proportions of the different percentages of overcrowding amongst the counties. We can see clearly that it's right skewed. The data lingers on to the right. So I created this histogram using the .hist function. It was fairly detailed. I had bin count equal to 200. And yeah, here it is. So, as can be seen from the histogram, the distribution of proportion of overcrowded households among all U.S. counties is very right skewed, with most of the rates being between 0 and 5%. So the number of counties with rates above 20% is very marginal. But they are there, but it's very marginal and few, which is why the figure is zoomed in. I used the dot zoom function as well, such that the x-axis ends at 20. But originally the axis would have stretched, uh, I believe, to 55%, as that's the maximum, 51%. Uh, so you can see, where did I use? Oh, I had the X limit, X axis limit from 0 to 20. I didn't use the dot zoom function. I used the X limit function. But let's go back a few slides to the summary table, and let's look at the minimum and the maximum. The maximum for percent overcrowding is actually 51%. And I only go to 20%. So that's just to show that the X-axis could have gone on a lot further. Um, so that's exactly what's going on. Histogram captures a lot of the skew in the distribution, and it tells us that there are some outliers. Second explanatory variable. So what I'll be doing actually is I'll be just talking about the explanatory variables I want to use first. There was a lot of variables in this data set. So I picked out a few explanatory variables that I thought would be very applicable uh, to correlating overcrowding and community health. Response variable we'll talk about later. That's actually percent of fair or poor health. That's actually measured by the person themselves. Our response variable is a person is polled and they're asked, do you think you have excellent, very good, good, fair, or poor health? And that person is responding themselves. So it's a self-measured variable, our response variable. But right now, as we're looking at the second explanatory variable, which is primary care physician, this one is also interesting, but I have my doubts about it. I'll talk about my doubts about it in a second. But it measures how many people there are per physician in a U.S. county. So I'm including this variable on the assumption that areas with more people tend to have more people per physician. Yeah. So more people per physician can be an indicator of more densely populated counties. And going further, it would be interesting to see if there's a relationship between this variable and community health. Because there may be a correlation in some counties between the number of doctors available for the population and health outcomes, in this case, how residents of the county score their own health. So this could go one of two ways. People with more access to physicians could know more about their health. And so what they say in their response variable, how they rate their health, could be more indicative of their actual health. People with less access to physicians, who knows, might think they're more unhealthy than they are, might think they're more healthy than they are. It could skew either way. But this is a variable that you cannot read into as much as the overcrowding variable. The overcrowding variable is precise. It's actually relating to exactly what I'm looking for. This one is a little bit more on the fringes of being, you know, relative, topical. You get what I'm saying? So again, I make a histogram for this variable as well. And here is the histogram. I use the dot hist function. Bins again, the bin count 200. I thought that was detailed enough. We could have we could have been a little less detailed with this one, actually, because you can see it's very zoomed in. And I limit the x-axis to 300. Although if we go back to the summary stats table, we can see that the maximum for primary care physicians is 514. So it goes on quite a bit more. Clearly, it's again right skewed, but it's right skewed to a lesser degree. It's densest between 10 and 100. And in fact, most of the data is between 0 to 150 people per primary care physician, with any values above 300 being marginal. Uh, Hence the upper limit on the x-axis. But yeah, as you saw originally, the data stretched to 600 because the maximum was 514. 514 people per physician. That's what it means. So yeah, we have information here, the maximum, the histogram, x-axis. Let's move to the third explanatory variable, the final one, which is percent rural. This is one that I thought was could be interesting, has the potential to be very interesting. It measures the percentage of the population and households that don't live in an urban area. So this would mean having less than 2,500 residents in any area that is census designated by the U.S. Census Bureau. Okay, so since it is very precise, again, we had 3 people per room for the overcrowding measure. Now we have 2,500 people per any U.S. Census Bureau designated area. Less than that, you are rural. But this variable, it reflects pretty much the inverse of suburban urban living proportions. We're looking at the inverse now. We're talking about overcrowding. So the lack thereof, we want to understand how does that affect mental and physical health as well. So this is an important variable to add into our explanatory variable bunch. Um, so it gives us insight into the outcomes of living outside dense areas, which provides contrast in the face of my other explanatory variables, as I said, where the focus would be more on crowded areas and their relationship with health outcomes. And as well, there's a distinction between rural and urban. It's very simple. It's a simple determinant of population density levels, which connects smoothly to my research question. U.S. Census Bureau actually has 3 labels: rural, urban, suburban. If you're not rural, you're either suburban or urban. So actually, I have another variable or histogram where I plot instead of rural, percent urban or suburban, and it's just the complement of the rural histogram or the rural variable. So let's take a look at the histogram for this. Here's the histogram. Oh man.